Let's now come to something that is a little difficult to draw. I'm going to show you an easy way, but yes, you will often read this kind of theory. Its bulky organ lies below the right costal margin, extending on to the left costal margin. Okay. In case of small kids, it's about 2 centimeter below, you can palpate it. Okay. In case of adults, you can palpate it 1 centimeter below the costal margin. In a person with strong abdominal wall, you can't palpate the liver at all. Right. This is all theory that's given. How do you draw it? Upper border, right border, lower border. So much theory. How do we do this? I'll show you how to do it. Come. So this is the image I've given you. This is the patient you have. Draw a point just below the right nipple. This is the liver you want to draw. Okay. Draw a point at the xiphisternal joint. Draw a point just below and medial to the left nipple. Draw your line slightly depressing downwards here. So that's your upper border. So how do you draw the lower border? Take a point 1 centimeter below the right costal margin at the lowermost point at the 10th rib. Go to the tip of the 9th costal cartilage. Take the point a little inwards, transpyloric plane, and then back upwards here. Okay. So what happened is when you draw this line, draw it dipping inwards here and then coming to the lowermost point. The right margin is drawn with a outward convexity like this, and there you have your liver. I have pushed it inside so that you get a better orientation of it, but the points will remain exactly what I told you. This is how we draw the liver. Okay. Now question is, how do I draw the gallbladder? Remember this little notch that we drew? This is where you can draw your gallbladder, just edging, coming out of the inferior margin of the liver. That's where you will find your gallbladder. Next question is, what is Murphy's point? The point of junction between the right subcostal margin and the linea semilunaris at the tip of 9th costal cartilage is the Murphy's point. Right. How does all this knowledge help you to make that little incision for purpose of liver biopsy? So remember, when you learnt about the lung, the lower border of lung extended till the 8th rib. The lower border of liver extended till the 10th rib. Correct? So you've got the 8th intercostal space and the 9th intercostal space through which you can easily put your needle for collecting tissue for liver biopsy. Were you to go above the 8th, you would be puncturing the patient's lung, which you don't want to do. So thus your knowledge of surface anatomy helped you to carry out the procedure of liver biopsy. Right. Let's talk about some structures of the porta hepatis. First, the porta hepatis itself. Go 5 cm above the transpyloric plane, 2 cm to the right of median plane. Using this as the midpoint, draw a horizontal line 2.5 cm wide. That's your porta hepatis. Now, from the porta hepatis, you can draw your bile duct, you can draw your portal vein. Come. So now I'm going to draw the bile duct as a structure coming from the midpoint of porta hepatis downwards and laterally with a rightwards turn, 7.5 cm long. That's my bile duct. What about portal vein? What do I already know about portal vein? I know my portal vein is formed at the level of transpyloric plane. So I will begin it at the transpyloric plane and carry it upwards to the porta hepatis. There I have my portal vein. Very simple. So my dear students, if you like this video, do please like, share and subscribe to my channel. Remember to hit the bell icon